This is Manu, Kalia. I'm going to answer a common question by one of my viewers, Chondromalacia Patella. And for those of you who don't know what that is, it's Chondromalacia Patella is degenerative changes to the cartilage underneath the kneecap. So either due to improper rubbing or excessive wear and tear or an injury. So difficult to work on strengthening exercises without irritating either the chondromalacia, and for that matter, the other issues that have developed, for example, quadricep tendon issues, or tendinosis type problems, or the bursitis under the quadriceps. In my view, in order to work on maintaining the strength of all those structures without aggravating either the chondromalacia or the quadricep tendon, all these tissues, an exercise or a mobility routine has to be designed which will focus initially at least on more non-weight bearing activities, as well as doing more hands-on techniques like massage, acupressure massage, cross-friction massage for the quadricep tendinosis, as well as more use of heat and other things like herbal supplements to improve the circulation of that tissue so all these tissues heal, and to prevent ongoing irritation of that tissue. So what I mean by non-weight bearing exercises is that you want to focus more in the acute stage, or when things are really irritated. I mean, it could be a chronic injury, but it's so irritated when you get back to trying activities like, for example, could be walking, running, jogging, or weight-bearing exercises like squats or lunges, any of those type of things. It aggravates the tissue even more. So you have to focus more on non-weight-bearing things like exercise in laying down positions. So for example, straight leg lift, right? So a simple exercise like a straight leg lift is not doing the repetitive bending and extending at that knee, so which might be less irritating for that kneecap, like chondromalacia, or for that matter, for that quadricep tendon issue that's going on too. Yet it allows me to still work on maintaining the strength of that quadricep muscle. So as well as doing other things in laying down, for example, hip abduction movements to strengthen the glutes. You might be able to get away with some bridging activities too, as well as doing a lot of the mobility exercises to work on maintaining the mobility of that joint, as well as the local soft tissue, the muscles, the quadricep, the tendons. Okay, so but focus on non-weight bearing stuff first, which allows you to maintain the strength and mobility without irritating the joint. So the first rule always is avoid activities or things that continue to exacerbate or irritate your symptoms. So for example, if I have rotator cuff problems, and when I do overhead things, if I grab a hammer and I go overhead and I'm doing overhead movements, it irritates that rotator cuff, possibly compresses it, right? Pinches it. But I persist, it hurts, I bring it back down, and then I go back and try it again. If I keep doing that movement, it's going to keep irritating that tissue. So rule number one, avoid that specific activity. So in your routine, avoid the weight-bearing things, no squatting, pick activities like walking in water, for example, right? Possibly you can get away with doing a little bit of stationary bike, but sometimes that's irritating for this also. Right? But focus on the strengthening there, work on massage, use of heat, or doing Epsom salts. So all those other things and various herbal supplements, things can be taken to improve the health of the internal system, as well as provide nutrition for the joints to help the tissue heal. So that would be a much better strategy to get to this. And once the tolerance is there, can do the loading, and the tissue is not as irritated, then you transition to the weight-bearing task. And if it's severely irritated, sometimes you might have to wear a knee brace, you might have to do some ace bandaging to support the joint, you might have to use a cane or crutches or a walker. It all depends on how severely irritated the tissue is and how much it wants unloading. Okay? So I hope that answers your, and I hope it helps other people too who have this issue and who are also trying to figure out how they can design an exercise program without continuing to irritate that tissue. Please share the video so others can find benefit from the video also.